Are you wondering if you're actually making progress after your knee replacement? Well, you're not alone. The truth is, most people have no clue what real recovery is supposed to look like. Pain lingers, swelling comes and goes, and sometimes it just feels like a guessing game. But today, I'm going to show you 7 clear signs that you are on track, even if your recovery doesn't feel perfect yet. And stick around because I'll also share a few things that don't mean you're failing, even though they freak most people out. So I'm Dr. Dominic Rangel. I'm a physical therapist based in San Antonio, Texas, and I help busy, active adults recover from surgery, reduce pain, and get back to their lives without wasting time in crowded clinics or relying on cookie cutter rehab plans. If you're post-op and wondering, is this normal? This video is definitely for you. So the first thing that you're going to look for, are you gaining range of motion? Let's start with that. Your minimum target for knee is going to be 0 degrees of extension, which is completely straight, and 120 degrees of flexion. That's how much you can bend your knee. Sometimes more, right? You can gain more than 120 degrees. Depends on your lifestyle and your activity goals. But you don't need to be perfect right now. What matters is just weekly consistency. Small gains over time. For knee extension, we want it to be perfectly straight pretty quickly, right? We want to gain like 5 degrees every week. And we're solid with that. But for knee flexion, we want to gain like 10 to 15 degrees per week. So that way you're consistently making improvement, right? We're looking for like 90 degrees of knee flexion at around 2 to 4 weeks out of surgery. But at 6 weeks, we want to have that 0 to 120 degree mark. The biggest tip that I have is I recommend you track this using a goniometer, right? That's what we use in the clinic. It's a simple tool and it lets you measure at home and track your progress. I'm going to put a link in the description so that way you can get it if you want it. Number 2, the pain is becoming more predictable. Pain is literally the most frustrating part. It starts out as random and constant. As soon as you hit that like 24 to 48 hour or the 48 hour to 72 hour mark, you're going to have a ton of pain. It's going to hit you like a ton of bricks. But one of the biggest milestones is when pain becomes predictable. For example, you have stiffness in the morning, you're sore after walking too much, you get tight after you go up and down stairs. That's actually a good sign. It means that your nervous system is calming down and your pain is now tied to stress related activities for your knee, not just damage. That's like a shift from it just hurts all the time to I know why it hurts and I know how to manage it as I move forward. That's a huge step. Number 3, you're using fewer meds. Needing less pain medication, even if it's just less often, means your body is adapting and healing. I have patients who cut their Tylenol in half or go from every 6 hours to once a day. It's subtle but real. And we celebrate those wins because we want to make sure that you are trending in that direction. They won't replace meds completely. But number 4, you're walking better and longer. Ask yourself, are you walking further than you were 2 weeks ago? Are you taking fewer breaks? Have you graduated from a walker to a cane to no assistive device? Did you go straight from a walker to no assistive device? That's real functional progress. I also recommend using a cane if you're in between phases. So like, let's say you're on a walker and you're ready to get rid of it, but you feel like you're just not steady enough. That's when I offer That's whenever I recommend that somebody goes to a cane. It's going to offer a little bit of control, but you're not going to be depending on the full walker. We're going to put a link in the description to give you the cane that's the most simple to use, and it's not very expensive. Number 5, swelling is going to be going down. Swelling after activity is totally normal, right? But we want to control that. It should reduce by the next morning or the next day. Remember, swelling is going to be one of those things that you're going to use to track if you're going too fast. If you're seeing less swelling week to week, especially with proper rest, icing, and elevation, that's a really good sign. That means that you're able to control your swelling, right? You want to make sure that you have the correct ice wrap. And if you don't have one, I'll also drop a link in the description for a cold compressed knee wrap. It's going to be easy to use and easy to take on and off. So the bonus part of this is if you elevate your leg at night, small changes add up big here. The more you spend with your leg elevated above your waist, then it's going to just slowly reduce that swelling over time. Number 6, you're getting stronger and we can prove it. If you're feeling stronger, that's good. We like that. I love that. But I don't always rely on what the patient is telling me. I test patients weekly with a handheld dynamometer starting at around week 12. It's a device that tells me exactly how much force in pounds and pounds that you're going to be able to utilize and produce using your quads, which is kicking your leg out straight, and your hamstrings, which is going to be bending your knee. We're not guessing, we're tracking it. Even if you're doing home rehab, this tool is a great investment if you're serious about strength. Number 7, daily life is getting easier. At the end of the day, this is what it's all about. You had the surgery for a reason. It's like, can you get in and out of the car more smoothly? Can you stand and cook longer? Can you shop without needing to sit at literally every aisle? I bet you probably couldn't do that pre-surgery. That's the whole reason why you had it. So let's make sure that you're hitting those goals. You're having less struggle, you have more confidence. That is what real recovery looks like. Not just better numbers, but better functional life. So, what doesn't mean that you're failing? Let's clear that up because too many people panic over these small things. People are worried that, oh man, I'm still having pain and it's only been 6 weeks. I'm like, dude, you had this huge surgery. It's going to take like 6 months to a year before you're feeling better. They worry about not being perfectly straight yet. It's gonna get there. Like, give it time. Just keep focusing on it. Prop your leg up 60 minutes a day in total, not straight, just 60 minutes in total. And it's going to continue to get better. If it gets stuck and you're working with me, I'm going to let you know and be like, hey, I don't know why this is not getting better. We need to figure out if there's something that the surgeon needs to help out with. People are always worried about needing help with stairs. Your quad and your hamstrings and your glutes are all weak because of all this pain that you've had for so long. You need to give yourself time to gain that strength so that way you can produce enough force to get you up to the next step. You got to stop comparing yourself to someone who recovered faster or even just one leg to the next. Even if it's the same person, the same surgeon, but two different legs, you're going to have two different outcomes. Sometimes one leg is going to move faster than the other one, and that's okay. Somebody, even if it's like your significant other had the surgery and they're ready to go after like 12 weeks, which I've had before. I've even had it where some people have the surgery and they're ready to go like 6 weeks later. It just depends on your goals. It depends on how much work did they have to do when they went in to do the surgery. It depends on how much better does your core come back right after the surgery and how much better were you able to control the swelling. Did you move too fast? Did you not move fast enough? There's so many different variables that you have to factor for. None of the things that we talked about mean that you're behind. Your body's going to heal in these phases. And that's why we don't utilize time-based progressions. We're going to use criteria to progress you while you're coming into the clinic or while we're going to see you. And the only thing that matters is that you keep on moving forward, not how fast you keep on moving forward. So let's go ahead and recap everything that we've talked about. If you're seeing any of these, you're seeing like better range of motion, more predictable pain patterns, less medication use, you're walking better, you don't have as much swelling, you have measurable strength improvements, and your daily life is getting better, then you're on the right path. If you're not seeing these yet, don't panic. It just means that we need a better plan or we need to modify the plan. And that's why I help people with, and that's what people with every day. So if you want extra eyes on your knee replacement recovery, I offer virtual and in-person consults to help you. Let's get clear on what's normal, adjust your home routine, and finally feel confident that you're healing. The ways that you can contact me are going to be in the description below, and you can go ahead and book a call with me so that way we can make sure you're moving in the right direction and that all of your questions are answered. If this helped, like this video, subscribe, drop a comment with your recovery wins or your struggles. I literally read everyone and I try and respond to every single one of them.